experts, thought leaders, and bringing you timely information, critical information, and credible information. So, Dr. Arjun Dang, thank you so much for being with us today.
Thank you, Bhavna. It's an absolute pleasure and a privilege to be here in this wonderful initiative by CII IWN. And actually, if you remember last March, WHO had called this an infodemic. So the only way to actually tackle it is to get the right information out so that people can take timely action, and also we can save lives with spreading the correct information.
Absolutely, absolutely, Arjun. And I think that's really critical in this sea of misinformation and overload information. I think the pandemic is of information overload as well. So a very warm welcome. And I think we'll just dive straight into questions. And I just encourage the audience to keep writing their questions and we'll take them in a few minutes. So while we wait for those questions to come in, I have some of my own, Arjun. Okay, so Arjun, what if, I just want to start with when is the right time to test? So for example, one, let me say, if I've been exposed, but I have no symptoms. The second would be if I have been exposed and I'm demonstrating mild symptoms. And the third would be if I haven't been exposed, at least to the best of my knowledge, but I have some obvious symptoms, whether it's a sore throat or, low-grade fever, cold, whatever. So can you tell me when should I test?
Sure. This is a very pertinent question, Bhavna. Because after more than a year of COVID testing, what we've actually realized and acknowledged is that the timing of the test is very crucial in order to get an accurate diagnosis. Obviously, if you test too early, then you can get a negative. But I'll explain this in detail. But before that, let's start with understanding the window period of this particular virus.
Yes.
So the window period for any infection is from the time of exposure till the time of you developing the symptoms, or in other words, that the test catching the virus or detecting the virus. So the window period for any infection varies. But with COVID, what we've seen is that this window period, or in scientific terms, we call it as incubation period, can vary from 2 days till 2 weeks. But the average again being about 5 to 6 days. So now I can go on to your question. So I'll broadly categorize the people that you've mentioned who need to get tested into two broad umbrella categories. So the first one are the asymptomatic cases and the symptomatic ones. So when you look at an asymptomatic person, that is, if you, for example, met someone who's tested positive, or you've been in touch with someone who's found to be positive, and then you're panicking. So the thumb rule for anything, especially with COVID, is that do not panic. Because there are very simple basic guidelines that you have to follow. And then a majority of the cases, touch wood, are not showing any kind of severe illness. So when you are asymptomatic and you find out that the person is tested positive, the main thing for you to do is not rush in for a test. Because even if you test at that time, that's in the window period that I just described to you, you will get a negative, and that's going to be a roller coaster ride, because then you'll get that false sense of security. Then you'll be going around and spreading the infection to others. So asymptomatic cases wait for the average incubation period to end. That is 5 to 7 days. If you can wait for about a week, that's great. But then in this time, isolate yourself from the elderly in the house and others in the house. Monitor your symptoms, and in case you get any symptoms, like you're monitoring your fever, your oxygen saturation, etc., and if you get a fever, then you test immediately. Again, coming to the symptomatic cases now. So if you have mild symptoms, or you have moderate symptoms, or any obvious symptoms, whether you've had exposure or not, I would certainly urge the people to go in for a test as soon as possible. But then again, someone with mild symptoms, if you're testing, if you just probably just have mild sense of loss of taste or smell, and you test negative, but the symptoms are persisting, like influenza-like illness, like cough, cold, fever, etc., then you have to repeat that test in 48 to 72 hours as well. So basically, in a nutshell, asymptomatic people don't need to test, wait for a week, isolate, monitor, and then test. Symptomatic can test ASAP.
Okay. Thank you. That actually clarifies a lot. Okay, now what does the CT value on an RT-PCR actually tell us? And I mean, is there a role that it plays in, say, the treatment? Does it indicate a viral load? What is it? Is it, how contagious you are? What does it mean?
Sure. So I'm going to take a couple of minutes, and this CT value and the CT score and these various kind of figures that people keep telling with their reports is going to be completely clarified. So to start with, this test, the RT-PCR test, globally also, in India also, this is a qualitative test. So even the people, even the manufacturers of the kit tell us that you're not supposed to mention the CT value on the report. Globally also, no one is really mentioning the CT value. But then again, with the Indian physicians obviously tackling this pandemic and trying to improvise, we
Yeah.
do give the CT value. But then again, remember that the CT value is a very broad indicator of how transmissive the person is. That is, how much is the person transmitting the infection.
So how
Obviously,
contagious they are?
exactly. So how contagious they are, and obviously higher the viral load, the more contagious they'll be. So again, for you to understand how we derive the CT value, so like how us humans have DNA, the virus
Yeah.
has RNA. So in the process of detecting this RNA from the swabs that we take from your nose and your throat, so we are
Yeah.
actually trying to detect this RNA that has specific genes of the novel coronavirus. Now, in this entire test, we do the test in cycles. So first we extract the RNA from the swab, and then we
Yeah.
are searching this swab for those two genes that actually signify COVID-19. So the entire process is done in cycles. So it's
Yeah.
cycle 1, cycle 2, cycle 3, cycle 4, up till cycle 35. So
Yeah. Yeah.
obviously,
Absolutely.
faster you catch the virus, that means if you catch it in cycle 5 versus cycle 25, that would mean obviously you've caught it faster because the viral load is high and it was easier for us to detect it. So lower the CT value, higher the viral load. And obviously any viral load that is more than 30, I told you we run it till 35 cycles.
Yeah.
Any value that is closer to 35 or around 30 or more than it can obviously be the residual or the dead virus that the test is picking up. Again, you must understand that after 14 days, the virus itself, so a lot of studies say 12 to 14 days and so on and so forth. But
Right.
after this particular time, no person is transmitting the virus. They are not contagious anymore. The harmful effects also that we see is because of the inflammatory damage that the virus has done to the various organs. So certainly a CT value that is detected after 14 days of infection is completely insignificant. Now, with the latest guidelines of
Mm.
ICMR also, they say that you need not test after 14 days of isolation. And if you've completely recovered and are asymptomatic, you don't need to test at all. You can be declared as COVID negative and you can resume normal life.
Right. Right. Okay. So just a quick question on this, like what you said about 14 versus 25. Like, let's say somebody, is cycle 14 versus somebody CT is 25. So does that mean that they were more contagious than the person who was caught at 25? And secondly, there was this whole debate, at least some doctors were saying that you are, even after 14 days, you're okay. But if your CT was lower than a certain number, you're contagious for 28 days more. So is that theory then out the window, or because
So
you're
there
14 days,
There,
right?
yes, Bhavna. So I've also read this literature that you are referring to. Now,
Yeah.
obviously, there are various healthcare authorities that have different guidelines. But what is prevalent in India right now, and the one that I follow, is the 14-day rule. So after 14 days, if you're completely asymptomatic, you are not transmitting the infection to others. But to be on the safer side, obviously, you can extend it up to 17 days to 21 days also. And this can be
Okay.
from the time of your first positive report. So again, you manage to add a few days between the first symptom and the first report. So you are giving it a significantly good time. And only if you're asymptomatic, then you can be declared as COVID negative.
Okay, great. Thank you for that. Also, can you give us some clarity on rapid antigen testing and its efficacy or its use? Can you talk about
Sure.
that a little bit?
Sure. So as we all know, RT-PCR remains as the gold standard in testing. But we
Yeah,
also have these rapid antigen tests that are
yeah.
very quick, like the name suggests, and also they have a low sensitivity. So what that means is that you get the report very fast. It is very inexpensive. But then any negative that you get on a rapid antigen test, and if the patient has symptoms or the doctor is suspecting COVID-19, then you must go in for a confirmatory RT-PCR test. Whereas a positive in a rapid antigen test can be considered as a true positive, but we have to be very, very cautious with a negative on a rapid antigen test. But then again, I feel the rapid antigen test, like in a country like India, where there's a lot of dearth of medical facilities in rural areas, in tier 3 cities, etc., the rapid antigen plays actually a very, very good role, because obviously something's better than nothing at all. And
Nothing.
the rapid antigen also can catch people with a high viral load, label them as positive, and then you quarantine them. The rest can figure out how to get an RT-PCR done. So definitely it has a very, very important role in a country like India, but has to be done very cautiously.
So amongst these three tests, the regular RT-PCR, the rapid RT-PCR, and the rapid antigen, which of them do you think is most accurate?
Sure, sure. So certainly rapid antigen is not at top of the list, like I just mentioned. The
Yeah.
RT-PCR, that is the gold standard currently and has a sensitivity of about 70%. Now, Bhavna, the test that you're mentioning as the rapid RT-PCR is
Yeah.
nothing but what we call as a CBNAT or a gene expert test.
You guys
So,
are
so I,
doing this, right? At Dangs Lab, you're
yes,
doing this, right?
yes,
4 to 6
yes.
hours you're giving. Yeah.
Yes, so I'll just explain to you how it works. So in a
Yeah.
RT-PCR test, we are actually running 96 tests at the same time in the machine. So that means we sample 96 people, get their swabs, extract the RNA, and then
Yeah.
generate 96 reports at one time. But in this rapid RT-PCR, or in other words, in the correct words as CBNAT or Gene Expert, we have a cartridge-based single RT-PCR kit. It's based on RT-PCR technology, and that
Okay.
single cartridge can go into the machine and give you a result. So this result actually comes out in about 45 minutes or even lesser if the patient is positive. So you can churn out dozens of tests every hour with this, but obviously it's more expensive than the routine RT-PCR. So this CBNAT, I would say, can be used for urgent cases, for critical cases, like we get a lot of requests from hospitals where the patient is critical and they're unable
Yeah.
to get a diagnosis. So this CBNAT is a very useful test because it can give you a result starting from 2 to 4 hours, depending on where we collect the sample.
Awesome. Thank you. All of this is just making everything so much simpler and clearer for us, you know. So what are the CRP, D-dimer, IL-6, ferritin markers? What do they reflect in COVID actually?
Sure. So actually, Bhavna, it's slightly amusing, but these tests have been around since ages. And I
Yeah.
think in this whole COVID pandemic, if there's someone or something that's been extremely happy is the CRP test, because it suddenly becomes so popular that
Popular.
everyone is talking about it. Like even my social media is full of tips on CRP, and I'm like, this is a traditional test that's being done since centuries again. So basically, all these tests, these are known as inflammatory markers. So
Yeah.
like you understand, when someone gets infected, there's inflammation in the body. Now CRP, so I'm going to explain the four tests here. So these are
Yeah, please.
CRP, ferritin, D-dimer, and interleukin 6.
6.
Now
Yeah.
CRP is a non-specific marker of inflammation. What that means is, if tomorrow you have a sprained ankle, or if you injure your back, and if there's any kind of inflammation in your body, even a gut infection with diarrhea, your CRP will be elevated. If
Yeah.
someone has rheumatoid arthritis or any other inflammatory problem, the CRP will rise. So certainly CRP is non-specific. So that means it's not specifically for COVID. It doesn't mean that, oh my God, I got a CRP done and it's elevated, I have COVID. No, not at
Mhm.
all. And also ferritin, being a non-specific marker of inflammation, again works the same way, that it can
Okay.
increase with any kind of inflammation, even a normal flu, even some kind of infection like malaria, dengue, where you have fever, it will go up. But then how is it useful? It's useful because in a COVID-19 patient, you're trying to monitor the CRP. So when you do it at baseline, and suppose your value at baseline is 1, and then slowly and gradually it's increasing from 3 to 5 to 7 to 10 to 20, you obviously know that you need to give the medication to get the inflammation down. So
Yeah.
monitoring the trend of CRP and ferritin is extremely important. And obviously, when the patient is on medication and treatment also, doctors aim and look at to understand the downward trend of the CRP. So this is very important for us to understand that there's a lot of waiting in labs these days for RT-PCR, and people call me and tell me, okay, doc, then do a CRP. We'll find out if we have COVID. So this is a myth I'd like to bust right here with our viewers, that it's
Yeah.
certainly not that. Now coming to D-dimer. So D-dimer again is a traditional test used to see how your blood is clotting. So it's usually included in anticoagulant tests to know how your blood is clotting. And as we already are aware, in COVID-19, your blood forms certain clots. So when you're trying to actually gauge if the person requires any anticoagulants, so anticoagulants are things like aspirin that thin
Yeah,
out the blood, then
blood
the doc
thinners.
checks for, yes. So the doc checks for D-dimer, and if this is elevated, then they get the right medication so that the D-dimer can be brought back into the biological reference range. Coming to the fourth one, and actually out of these lists, the most pertinent in severe and persistent cases where there's a lot of hypoxemia, the oxygen is dropping, the patient is very critical, is an interleukin 6 test. Now, this interleukin is basically a cytokine. So, cytokine is nothing but a chemical mediator of inflammation. So, we were talking about how the COVID-19 infection causes inflammation. Now, these
Yeah.
are little chemical messengers that actually get the inflammation up. Interleukin is one of these. So when you measure the value of interleukin 6, then
Hmm.
yes, we have certain drugs available that actually act as anti-cytokines. So cytokines are these chemical mediators. So then you actually hit them with these medicines so that the cytokines and the IL-6 levels come down, in turn reducing the inflammation as well. So again, these four tests are not advised for everyone.
Hmm.
Only in moderate or persistent or severe cases does the doc ask for these. Again, CRP, yes, a baseline can be done and to see if
Yeah.
the inflammation is actually increasing. But otherwise, these specialized tests like D-dimer and IL-6, etc., even procalcitonin, troponin T, troponin I, the list is long, but should only be done when your doctor advises you to and when you have persistent symptoms.
Awesome. Thank you. Doc, what about false negatives? False negatives, false positives. If we get a negative report and yet symptoms are persisting, what do you advise? And also, if you get two false negatives and your symptoms persist, is there any blood work that corroborates that you have COVID? How would you treat that?
Sure. So there's a lot of dilemma around this. Also, people are mentioning that there are certain variants and certain mutants that the RT-PCR are unable to actually detect right now. So
Yeah.
obviously, the medical fraternity is certainly confident that the kits available right now, and if the right kit is selected, then yes, we are not missing out on any mutants currently. At least that's what we believe right now. Only time will tell if we are correct or not. But apart from this, also, if you get two false negatives and the symptoms are persisting with this surge of the pandemic where we are actually sitting in, I would say that you maintain your isolation, even if you have a simple fever. And why I say that is that you maintain isolation so that if you actually happen to infect the other family members, then there'll be more panic and more testing requirement, etc. So continue isolation and then repeat your test after 2 to 3 days. And certainly, if the symptoms are persistent and if it's COVID, then it will be detected in all probability. Also, Bhavna, it's very important to understand that the load of the virus, if it's
Hmm.
above a particular threshold, then the test will detect it. So, certainly wait it out, be patient, stay isolated, and then repeat your test.
And
Whereas false
assume that you're
positive,
positive. Assume that you're positive, really. Right?
so I won't say assume you're positive because then people start self-medicating. I'll put it a little differently. I'll put it a little differently that
That's
yes,
true.
be patient, continue isolation, and then repeat the testing. So again, Bhavna, coming to your point about false positives. Now, this is something that's very important for all the viewers to understand also. From a scientific perspective, there is absolutely nothing that's known as a false positive in an RT-PCR or a rapid antigen. The only thing that is sure is when you get a positive on the report. But yes, with various labs overwhelmed by the tests and increasing and scaling capacity, obviously there are bound to be some kind of human errors. Now, the
Yeah.
most common human error that can actually make your report a false positive or make you see a positive on your report is any kind of labeling error. So if any of you've gotten a RT-PCR test done, it's basically the two swabs that are taken, and then you put it in this red colored or blue colored bottle, like that we call as the VTM. So always make sure that the labeling on this VTM is your name. Because today, if we are sampling person X who's negative
Yeah.
and put person Y's label on it, then obviously the results get swapped, and then that's what we call as a false positive.
I see.
So while giving your sample, just double check the labeling, and it takes a
Labeling.
second, but it increases the accuracy a lot.
Yeah, wonderful. Okay, now I'm going to ask you about antibodies testing. Which is the right test, and how long post vaccination should one test?
Sure. So firstly, Bhavna, there is absolutely no should in antibody testing because it is
Okay.
not a test you have to do for diagnosis. It's more for surveillance to see what kind
Hmm.
of immunity you've developed. Also,
Yeah.
secondly, I'll go on about the antibody testing, but it's very important to understand that when you get infected or when you get vaccinated, antibodies are not the only or not the exclusive way that your body is going to protect you against the virus. There's
Hmm.
something that we call as T cell immunity or T cells that are activated. And these T cells play a very critical role in fighting the infection. Unfortunately, currently there's no commercially available kit or testing methodology that can help us detect these T cells. But
Lisa.
very soon, maybe within a few weeks, we should have something. Again, coming back to these antibody tests. So if you've gotten a vaccine and you think that, yes, you want to know what antibody titer you have, again, before going for the test, remember, no matter what level of antibody you have, it doesn't mean you can't get COVID again. It
Hmm.
only means that, yes, the chances of you having a critical infection or being hospitalized is
Hmm.
significantly lesser versus when you didn't have a vaccine. So keep that in mind. There is absolutely no place for a false sense of security, even if you have
Okay.
a very high antibody titer. The antibody test that you must do if you're planning to get it done is a quantitative IgG antibody test that's targeted against the S1, S2 spike protein of the COVID virus.
Yeah.
Now,
So, what
there
is
are
the difference between these, the spike versus the IgG?
the spike protein is up. So you've seen those animated figures of the coronavirus everywhere with those
Yes.
spikes coming out. So
Yeah. Yeah.
that the protein present in this spike that is characteristic of SARS-CoV-2
Yeah.
is the antibody that we are trying to detect. So the
Yes.
IgG is the antibody that is the long-term antibody,
Hmm.
and this S1, S2 spike protein is a part of it. So IgG again is of different types, but we are trying to detect the spike protein type of antibody so that we get to know exactly what kind of protective immunity we have. And also, it must be a quantitative test. It should not be a semi-quantitative or a qualitative test, because only with a quantitative test can we exactly know what is the exact titer of the antibody that you have.
Okay, awesome. Arjun, I'm going to start with audience questions because I could keep asking you questions and I realized
So,
we won't get to the audience. So, okay, from Megha, after full recovery, 14 days of quarantine, should you test for negativity? If you still, and then second part of the same question, if you still come positive, should you still be kept away from family? If you come negative, that means you are no longer infectious.
so very, very important question and relevant for everyone to understand this. So, like I told you, the virus itself after two
Yeah,
weeks dies in the human body. So you're not transmitting the infection to anyone else. And also, like you said, if you've completely recovered, then you
yeah.
certainly don't need an RT-PCR test. Even by the latest ICMR guidelines, it's abundantly clear that you won't need a repeat RT-PCR test. Also, if you want to be extra cautious, you can extend the time period from 17 to 21 days also and wait for up till 3 weeks. But after 2 weeks, you can certainly be treated like a COVID negative person if you're completely asymptomatic.
Okay. Thank you. Parnika has asked, a friend came positive after being treated for 14 days and in quarantine for 19-20 days. Why did this happen?
So this is again a very common phenomenon. So we call this as the residual RNA or the dead virus that the RT-PCR picks up.
Yeah.
So again, like you understand, the RT-PCR test is unable to differentiate between a live and a dead virus. So even if the
Hmm.
inactivated virus is being picked up, Bhavna, actually it's very common. I would say 3 out of 10 people, or maybe more, test positive for more than 3 weeks. So certainly, it's very important for us to understand that there is absolutely no requirement for a follow-up test. But obviously, if someone's traveling, or even if offices have that requirement, that you aren't left
Yeah.
with much of a choice, but you can extend the 2 weeks to a 3 weeks. But then definitely you don't need a follow-up test, and you may continue testing positive even for up to 5, 6, 7 weeks.
Right. So this is like the shedding versus the dead virus almost in a way, right?
Exactly. Yes.
Okay. So Nandini, how good are the antigen tests? If one is negative in this test, can they still be positive?
Yes. So that's what I explained. If you're positive on the antigen test, then yes, you are positive. But if you're negative on the antigen test, then that certainly needs to be confirmed on an RT-PCR if you have the symptoms.
Okay. From Malika, my in-laws are still positive on their 19th day, no symptoms. So that's the dead virus, right? I guess she's just looking for confirmation.
Yes, Malika. So compliments to you. You've heard me very well. That is the dead virus.
We know who's listening. From Sadhna, my son had fever, bad throat, cold. We had him tested on the third day. Result was negative. Symptoms continued. We isolated him for 14 days. But we are confused. Should we wait to get his vaccine for the stipulated 6 to 8 weeks, or we don't wait and we get the vaccine depending on antibodies present?
Okay. So his COVID-19 test was negative. Did she say the COVID-19 test was
Our
negative?
result was negative. Symptoms continued. Isolated him. Should we wait?
Sure. So currently, again, unfortunately, but there is no vaccine available for children. So you actually don't have an option but to wait. And I would suggest that assuming that this was a COVID infection and the first test was a false negative, I would certainly say that give it up to 2 to 3 months before getting him vaccinated, because that is the latest guideline that if you get infected and you're wanting to go for a vaccination, that you should wait for the stipulated time period.
Okay. From Jasleen, is it okay not to have any antibodies after recovering from COVID and getting the 2 jabs? Is that
So
okay?
yes, that is possible in certain cases, but it's certainly nothing to worry about. It's definitely more common in people who are immunocompromised. For example, people who've had a transplant and are on immunosuppressant medication. But otherwise, there's nothing to worry about, because, like I told you, trust your T cells. So your T
Yeah.
cell response, which is not being measured right now, is one of the main ways that you fight this infection. So there's absolutely nothing to worry about. And I hope you tested the IgG antibody against the spike protein and not some other antibody test.
Well, now she's got the information, so she can. From Rinky, we've got post-COVID in the routine blood. If the lipoprotein has come high, is it due to COVID? Is it a matter of concern? And what is required to bring it back into the range?
Sure. So again, important question, but not at all related to COVID. So lipoprotein A is a part of your lipid profile. It's
Hmm.
something like a fat that is floating in your blood, like you see the LDL and the HDL. That's LDL is the bad cholesterol and HDL is the good cholesterol. Lipoprotein A is again one of the components of your lipid profile. So again, if it's elevated, I would request you to get a complete lipid profile done in a complete fasting state and remeasure it also. But again, not related to COVID at all. And any kind of elevation in lipid profile, depending on your age, I would suggest a lifestyle change to get those under control.
Thank you, Arjun. From Shibani, do you count the 14 days starting from the symptoms, 2 days before symptoms, or from the RT-PCR test result?
Sure. So Shabani, again, very important. And so if you count it from the day of symptoms, then it can be 14 days. But if you just want to be extra safe, I would say count it from your first report, because usually the report is a couple days or 2, 3 days after your symptom. But then again, all the literature that we've referred to is 14 days from the start of symptoms. So again, it's a fine line, but if you want to be safer, then I would say start from your first report and anyway, give it a few extra days.
Yeah, okay. So here on the side of caution, Shibani. From Rohit, where are all these tests done? Have all the labs had to recruit people, buy new machines on an urgent basis? How many tests do you do per week?
Sure. So like all of you know, way back in February, March last year, no one had even heard of this COVID-19 virus. But then the good part about it was that the same methodology, if you people remember H1N1 or the swine flu, the same methodology of the RT-PCR has been present in a lot of labs ever since the swine flu had appeared. And a lot of these labs have scaled up their capacity and also gotten the trained manpower. So it's slowly increased. The good part about COVID-19 was that even the government and even the private institutions scaled up very, very rapidly. So again, not going into exact numbers, but yes, at the peak of the surge, we were doing about 1,000 RT-PCRs a day. But then obviously it depends
Wow.
on the surge and then the pre-surge and then the post-surge as well.
Okay, thank you. From Jasleen, if the antibodies are high, should one delay taking the vaccine?
Okay, so firstly, what do you mean by high? Secondly, also, no matter what your level of antibodies it is, unless you've recently been infected, even if you've had some fever and decided not to test, I would say wait and don't get vaccinated because you've just recently gotten infected, assuming that it was COVID-19. Otherwise, if you have a very high titer and it's been more than 3 or 6 months since your last infection, you should certainly go for a vaccine because the vaccine is not going to do anything but to boost this antibody response further.
Okay. From Shibani again, you have been a pioneer in drive-through tests. Actually, you have. You've really been amazing. Do you have any plans for drive-through vaccinations as well? It would be so much easier and safer in the given environment. I agree with you, Shibani.
So
What?
Shivani, I 100% agree with you also. And certainly drive-throughs have ensured very quick testing and also minimal exposure. So versus when someone comes to your house and they've already visited a dozen houses before that, you have that apprehension that, okay, this person sampled to dozens of positives before me and he's coming with his bag and his PPE kit, etc. So
Oh,
again, drive-throughs have been phenomenal. But then the only issue with vaccines, especially in this initial stage, is that so if a person is coming in, you give them the jab through the window, all's well and good. But then the person's driving back and has a reaction or an anaphylaxis,
hmm.
then that certainly is a big cause of concern. So certainly a super idea needs to be implemented, but we have to give it some time so that there are more fixed protocols, or either what you do is start a drive through where the person waits the stipulated 30 minutes of the observation period
Yeah.
in the garage or the parking lot with their windows up and then drives. But I still feel that certainly just coming in and going out after a jab, it's really not recommendable at this stage, because even if a single casualty happens, then the entire initiative will be futile.
No, I agree with you. And in fact, I mean, I had my second jab yesterday and I had lightheadedness. They made me lie down. My BP was high. So actually, you're right. I mean, it's a great concept, but you'll have to figure out how to make that observation period,
Exactly.
yeah, part of it. Okay, from Pinky. Can antibody tests be done after the first dose of vaccine? If yes, after how many days?
So, Pinky, certainly an antibody test can be done at any point of time, but the time when it's advisable is only post 2 weeks of the second shot. And why we say that is that that's because the maximum immunity or the maximum antibodies have been known to develop after 2 to 3 weeks of the second shot. So, like these antibodies are dynamic. So, yes, in certain people, depending on your immune response, you might have antibodies even a couple weeks or 3 weeks after your first jab. But then if you're looking at seeing your antibody levels is the highest level, then wait for a couple weeks after your second shot.
Great. From Nandini, are there any tests which can indicate the black fungus infection?
Sure. So again, very important. Again, the social media and the internet is inundated by mucormycosis and this black fungal infection that everyone's talking about. But it's very important that not everyone who has COVID-19 and not everyone who has a severe illness will have a fungal infection. So fungal infections traditionally have been an opportunistic infection that are more common in immunosuppressed people or in immunocompromised people. Now, what
Yeah.
is happening with the injudicious use of steroids and even otherwise, when you use any steroids, you are suppressing the immunity of the already infected COVID-19 person. So
Absolutely.
when the immunity comes down and with excessive use of steroids, these fungal infections get a chance to thrive in the human's body. Again, they can present as various symptoms, but usually the physician or the doctor will look at a suspicious sign that will make them test. So, for example, if they suspect a lesion in the lung on the CT, then obviously an imaging is something
Hmm.
that will lead them further in diagnosis. If someone has blackish discoloration of skin that resembles a fungal infection, then obviously there are skin scrapings that we call as KOH scrapings that are used to diagnose this fungal infection. If someone has their sinuses as infected and they have a swelling in their nasal tract, then obviously then the ENT will suggest for a swab that tests for fungus as well. Apart from these, fungal cultures also can be used to detect the same.
Okay, thank you for that. Okay, from Tanvi, thank you for the wonderful session. How are the labs preparing for the future waves, like the third wave and the fourth wave? How do you predict we will recover from here for the upcoming waves? What research is being done to build more efficacy in the testing and treatment process?
So, very important. The only thing that probably everyone's talking about now, at least in the medical fraternity, is that in a city like Delhi, we never really expected the surge to happen like this at such a rapid rate, where everything went from 0 to 100 within a few days. Even the
Yeah,
medical
absolutely.
facilities were overwhelmed, people were confused, and then now there's complete lockdown. So, being prepared is certainly extremely important for the next waves, like you said, wave three, and hopefully not, but a wave four. So again, there's a lot of research going on. Number one at the top of the list is a genomic sequencing, wherein we try to understand the virus better. We try to understand the mutants better. We
Yeah.
try to curate the kits, the testing kits, in a way that we don't miss out on any mutants. And also at the same time, the vaccine manufacturers can slowly develop vaccines and modify them so that they give more protection against these mutants. Apart from this, also we are also working with a lot of R&D on saliva based testing. So it's very interesting because currently the whole process of RT-PCR testing is that you have to go to a lab, the person wears a full PP and then takes your swabs, etc. But then a saliva test is going to be as simple as collecting your saliva in a cup and sending it to the lab and then we test it. So certainly it's the same technology of the RT-PCR, but then it's going to making the whole process quite easy, not only for the person getting tested but also for the labs. So certainly new testing modalities, genetic sequencing, and even vaccine developments are something that's going to help us all together fight the future waves together.
Thank you, Arjun. From Lata, while the doctors are treating patients in ICU due to COVID related issues, do they still do COVID testing if 14 days are over?
So in the ICU, again, it would depend on the physician. But if a person has recovered well, then obviously it's not required. If the person's symptoms are persisting, then in some cases, yes, the doctor will ask for a repeat RT-PCR test. A lot of times also, because if the RT-PCR test comes negative when a person is in the ICU, then you can probably shift them to a negative COVID ward. So probably
Okay.
doctors are also thinking from that aspect, and the family also, that if you're in a COVID ward and if you've recovered, you obviously want to move to a non-COVID ward.
Okay. From Rohit, are people requesting a lot less of the normal, i.e. other tests to be done? Does this imply that we have other health issues building up that we are not thinking about because we're so COVID focused?
Certainly. So normal tests like oncology, lifestyle diseases, etc., obviously have taken a backseat during
That's
this
it, yeah.
pandemic. And also when we saw the first wave end and before the second wave, things started picking up. But I do hope that this wave finishes soon and we get back to the bigger health issues that like lifestyle diseases and also oncology, etc., pick up soon.
Thank you. From Aman, what are some symptoms of COVID which could remain after months of recovery?
Sure. So again, a lot of people have complained of headaches, body aches, tiredness. All of us are well familiar, and even Dr. Sibyl was mentioning in the earlier sessions, the
Yeah,
brain fog that develops post-COVID. So
yeah.
certainly, again, combined with weakness and these bodies aches and pains along with a headache is something that has been seen even for prolonged durations.
Thank you. So Nils, I think you've already answered. Can we assume the person cannot be a carrier after 14 days of symptoms? You've already answered that. Lata, how long do you continue to have vitamin C and D, as it's generally recommended to be continued even post 14 days?
Okay, so very important to understand that vitamins should not be taken more than the recommended amount, because as soon as they are more than the recommended amount, then you are just putting unnecessary pressure on your kidneys to excrete these. So, for example, when you talk about vitamin D, the adult dosage is 60,000 international units per week for 8 weeks. So again, you can't be having these vitamin D doses of 60,000 international units every day. You have to have it once a week for 8 weeks. And certainly, all of you should understand there's also something known as vitamin D toxicity. So when
Yeah.
your value reaches more than 100, depending on the unit, obviously, you have these very, very severe symptoms of vitamin D toxicity. So be very careful about taking only the prescribed dosage and the frequency also as per your physician only.
Okay, thank you. I think we'll just take one or two more questions, Arjun. We wrap it up because I know we've gone over time also. From Pinky, how long after recovering from COVID should one take the vaccine?
So yes, there are various guidelines, but the current guideline that I'm familiar with says 3 months after having recovered. The reasons for this is primarily because obviously after the infection, you do develop antibodies. So the whole point is that you let this immune response or the current antibodies reach a peak level, and then you put the vaccine so it gets boosted further. So certainly you should wait a few months, possibly 3 months, and then get your vaccine.
Thank you. From Lata, is the second vaccination effective if there is a gap of more than 8 weeks, as one will need to delay due to the recovery from COVID?
Sorry, say that again.
So basically, she's asking that is the second vaccination effective if your gap ends up being more than 8 weeks because you had to delay it because you were recovering from COVID? So what happens there? The effectiveness.
So certainly important question, because during this wave, a lot of people have gotten infected between their dose one and dose two. Again, if you're familiar with the most recent guideline that's come out today, is that it's further prolonged this period also. So again,
Yeah.
I would say that yes, after you get infected, wait for 3 months and then get a booster dose, because hopefully the infection and the first dose of the vaccine would have developed an immune response, and then again, the second dose will further increase it. There's absolutely no harm in taking the second shot after a few months of your complete recovery.
Okay. From Aman, does a person still suffer from little cough after testing negative from COVID? I think
Yes, yes. So again, like I told you, after 2 weeks, if you have any symptoms, it's more because of the inflammatory damage of the virus than anything else. So if your lungs have been infected and suppose you had even partial pneumonia, you will continue to have the symptoms for a few more weeks.
okay. Post-COVID symptoms such as palpitations, how serious are these? And are there any tests that we can do?
So again, this is completely in the arena of expertise of your physician. But again, palpitations can have various reasons to it also, and your physician will advise you exactly which medication to take. And also basic things like your blood pressure, etc., will need to be monitored to see the exact cause of this happening.
Okay. And this is our last question. Thank you. Do you feel that positivity rate is coming down and we have hit the peak in Delhi?
Yes, so I would certainly say that we hit the peak last week, and keeping my fingers crossed and touching wood while saying this. But yes, the peak of the second wave is hopefully over in Delhi, and we are seeing a decline right now.
Thank you so much, Arjun. It has been a real privilege and an honor to have you with us. It's been such an informative session and we've got such wonderful feedback already. Thank you so much, Dr. Arjun Dang, CEO of Dangs Labs. Thank you very much for being with us on Need of the Hour. CII IWN is very proud and pleased to be hosting this series. And we bring you thought leaders, doctors, and field experts. Please do join us tomorrow with Nitya Shanti, who is a spiritual teacher, and he will be talking about accessing your inner resilience. Thank you so much, Dr. Arjun Dang.
So, Bhavna, one point before we close. So, absolutely wonderful audience. I actually didn't expect such great questions from a non-medical audience. So, serious kudos to everyone here.
Oh, thank you so much. Thank you very much.
Thank you.
Thanks a lot, Arjun. Thanks.